Hello viewers, today we'll be talking about anti-diabetic drugs. So we'll talk about first of all diabetes. Now diabetes has become a very common disorder these days because in every family you will find at least one individual suffering from diabetes mellitus. Now by 2050 it is estimated that 1 in 8 adults would be suffering from diabetes mellitus. That means approximately 853 million people will be living with diabetes. That amounts to increase of 46%. And unfortunately in our country, India is supposed to become a diabetes capital. Now in next slide, we will be talking about the brief introduction about diabetes. Diabetes mellitus is a chronic disorder, a disorder of carbohydrate metabolism. The reason is that there is impaired ability of the body to produce or respond to insulin and thereby maintain proper blood levels of sugar or glucose in the blood. Now what is insulin? Insulin is basically a hormone produced from beta cells of pancreas. It regulates blood glucose. With the help of insulin, glucose has to enter into the cells. Otherwise, there would be raised blood glucose or blood sugar levels. This clinical condition is called hyperglycemia. When this very blood enters kidneys for ultrafiltration, there is appearance of glucose in the urine also. That condition is called glycosouria. So hyperglycemia and glycosouria leads to diabetes mellitus. Now, controlling blood sugar, we can't afford to have hyperglycemia. We can't afford to have a raised blood glucose level. That would damage our vital organs, especially kidneys, heart, eyes, nerves and blood vessels. So diabetes, I would say, is a very dangerous ailment. Now there are different type of diabetes mellitus. First of all, we have type 1 diabetes mellitus. Here the problem lies with insulin. There is severe reduction of insulin, or we can say absence of insulin, because of the fact that beta cells might have got destroyed due to autoimmune reaction. So we need exogenous administration of insulin here. Now in type 2 diabetes mellitus, insulin is there, but cells do not respond to insulin properly. Now type 1 diabetes mellitus, also referred to as juvenile onset diabetes mellitus, is totally dependent upon insulin. We call it insulin dependent diabetes mellitus. And type 2 diabetes mellitus was previously called maturity onset diabetes mellitus. Here it is non-insulin dependent diabetes mellitus. The other type of diabetes mellitus is gestational diabetes mellitus, which is involved with pregnancy. And then we have maturity onset diabetes mellitus, which occurs at young age. Here insulin is there, but diabetes mellitus is occurring at a very young age. We also call it maturity onset diabetes mellitus, but at young age. Then we will talk about secondary diabetes mellitus, where the issue is because of drugs. For example, beta adrenergic receptor blockers like propranolol. It can precipitate diabetes mellitus. And secondly, individuals who are on diuretic therapy, especially thiazides, they also become victims of diabetes mellitus. Now these are the possible signs and symptoms of diabetes mellitus. There is frequent urination, there is frequent thirst, there is weight loss, lethargy, increased hunger, fatigue, tingling in hands, feet, wounds are do not heal up, blurred vision. And secondly, causes and risk factors are because of degenerations of pancreatic beta cells. There is insulin resistance, heredity is an issue, obesity is a cause, sedentary lifestyle, pre-diabetics, and food habits is also becoming a cause for diabetes. Now, in order to combat diabetes, we have conventional therapy based on insulin administration, diet therapy, and administration of oral antidiabetics. Now we have better and newer the drugs or the strategy for the treatment of diabetes. We have target-oriented drugs. We lay emphasis on reducing insulin resistance, enhancing insulin sensitivity, and retarding carbohydrate absorption. Now we have so many classes of drugs available for the treatment of diabetes mellitus. First of all, we have older drugs or traditional drugs or first generation drugs. These are insulin releasers, insulin sensitizers, insulin and preparations. Secondly, we have newer drugs, latest drugs, second generation drugs. For example, dipeptidase, dipeptidyl peptidase 4 inhibitors, GLP-1 analogs, SGLT2 inhibitors, alpha glucosidase inhibitors. Next, we have drugs based on route of administration. Certain antidiabetics are given by oral route. We call them oral antidiabetics. And certain antidiabetics are given by parenteral route. We call them parenteral antidiabetic drugs. Now, oral anti-diabetic drugs, class number one, insulin releasers or insulin secretagogues that include sulfonylureas, meglitinides, phenylalanine derivatives, incretin mimetics like glucagon like peptide 1 agonist, dipeptidyl peptidase 4 inhibitors. Next, we have insulin sensitizers that includes bigonides, thiazolidinediones, and next we have some miscellaneous or other drugs, alpha glucosidase inhibitors that includes acarbose, miglitol, voglibose, amylin and analogs that includes primlinide, dopamine receptor 2 agonist that includes bromocriptine, sodium glucose cotransporters 2 inhibitors. We can have a classification of antidiabetic drugs on the basis of chemistry, that is on the chemical classification. First of all, sulfonylureas that includes tolbutamide, chlorpropamide, glycipide, glimepiride, glenbenchlamide, bigonides that includes metformin, thiazolidinediones, pioglitazone, rosiglitazone, meglitinides, rapaglinide, natiglynide, glucosidase inhibitors, acarbose, Thank you. Thanks for watching.